everyone. Welcome to today's edition of Stanford Live. We are so excited to be here with our speech pathology team. We will be talking all things inpatient speech pathology today, learning about what it's like to be a speech therapist here at Stanford, how to get your foot in the door, what are the different areas of career growth available here, different ways to become involved in the hospital, as well as just learning about the culture of Stanford and why our speech team has continue to create their careers here. So I would like to start off by introducing Aileen, our speech pathology supervisor, and she'll tell you a little bit more about how long she's been at Stanford and kind of a little bit more about her day-to-day life here.
Thank you, Carly. Hi, my name is Aileen. I'm this SLP supervisor here at Stanford. I've been an SLP for about 8 years, 7 of those years here at Stanford. My role is a hybrid in nature. I'm a supervisor, so I supervise the SLP team, but I'm also part clinical. So day to day is kind of a combination of admin work plus seeing patients. And here, this is my clinical specialist, Madison Fox.
Hi, everyone. My name's Madison. I'm a speech pathologist on the inpatient team, and I'm also the clinical specialist. I've been at Stanford for about 5 years, and I, as the clinical specialist, in addition to typical patient care, just support our team's implementation of evidence-based practice, facilitate project improvement, and provide resource to other clinicians that are in the process of developing new skills.
Thank you so much for those introductions. So Aileen, I guess to kick it off, I'm going to pass it to you. For anyone that is looking at, a speech therapy job with us, what is the day-to-day life like in your department? What can someone expect when they become part of the Stanford family? What's kind of the patient load look like? What are the hours, shifts? What type of culture do you have there in the department? Do you guys do team building events? Are there ways for you to get involved at the hospital? Additional certifications that you can get or obtain while you're part of our team? Just kind of, I guess, some selling points about what makes it a great place to work.
Absolutely. Yeah. So our department is, well, let me talk about the hospital just to give you an idea of where we work. It's a level 1 trauma center with 6 ICUs, 27 AAUs. We're a stroke center. We're BAD certified. It's a high acuity, fast paced teaching hospital. Our staff consists of about 14 SLPs, ranging from per diem, part-time to full-time. Our department serves patient populations including cardiothoracic, transplant, including heart, liver, kidney, lung, bone marrow. We have neurosurgery, neurology units, medical surgical units. Oncology is a big patient population here, and we see a good amount of head and neck cancer patients, as well as trauma. Let's see. So, we have quite a bit of resources available to us. We do MBS and fees daily. We have 3 fees towers with 12 scopes. And we have TIMS. We don't really get hardly any pushback from physicians. They readily order these exams for us. Often we can do them same day, which is really, really important to us when we're trying to provide evidence-based care to our patients. Team dynamics are very collaborative. We are a very close-knit group. We have a communication system, phones, with a Volt application where we can, we have a group chat every day. We talk to each other constantly. Oftentimes we, will collaborate on a case or look at each other's videos or swallow studies. We get input from our clinical specialist all the time. Let's see, as far as growth opportunities, we have Madison to help support any career advancing goals. She will, like, for example, if we want to present at a state or national conference, she'll help put together a proposal. So she'll facilitate that, provides mentorships for advanced skills like inline speaking bell, FEES training. We do a lot of scoping practice for our newer clinicians. There's outside of the speech department, there's several councils to be involved in. We have a rehab council that organizes social events, on campus, off campus. They put together parties. We have a student council because we have a very large student program for all disciplines, PTOT and speech. So there's a student council to be a part of, where they help mentor students and help the clinical instructors. There is a shared leadership council, as well as a clinical ladder structure that we are rolling out, which gives the opportunity for recognition of advanced skills and contributions to the department on a ladder structure. So you would enter the department as a 1 or a 2 level, like level 1, level 2 SLP, and then you have the opportunity to apply for a level 3, and that comes with criteria that you have to fill out an application, and you have to meet certain criteria to qualify, and that goes through an approval process. But I think that's a really a great way to be rewarded for your contributions here. Is there anything you want to add, Patty?
I think, like Aileen was saying, the level 3 and the level 4 gives you incentive for your career growth. Not all hospitals have that many level structures for speech pathologists, so sometimes you feel like after a couple of years you've sort of plateaued. And I really like that our department has sort of lifelong or career-long growth, career-long learning embedded into our culture. And I think that typically when we see people apply for positions in our department, or when people join our team, they usually come with that value also, that they value career-long learning, that they're really interested in flexing their skills and being introduced to a patient population that they haven't worked with before, or gaining skills that they didn't acquire at a previous job. One that's common is the FEES swallowing exams that we do. So people come looking for growth in different areas. And I think we have a really strong team that provides mentorship and is interested in helping people grow in their careers. So I think that's just a shared value that we all have.
Oh, that's awesome. Well, and we got our first question, so I wanted to pass this over to you guys. So Elaine asked, for speech pathologist who hasn't done hands-on MBSS and FEES, would you consider hiring them and providing training?
That is a 2-part question. I think our entry-level SLP does have to be independent with at least 1. So we prefer, they have to come in with usually MBSS. FEES, we are open to training and mentorship, as it's an advanced skill, and it's sometimes hard to get opportunities to practice or get exposure to that instrumental. So yes, for the modified barium swallow studies, that is a criteria to be considered for an SLP1. No to FEES.
Okay, and so then to kind of segue on that, so when you get, when you have openings, we have, speech pathology 1, speech pathologist 2. For those entry-level speech pathologist 1, do you take new grads? Is there a program here for new grads? Are you ideally looking for someone with inpatient experience? Do you accept someone with outpatient experience, or maybe school, clinic experience? What are kind of the reasonings behind the minimum requirements that you have? Just to kind of help those that have applied in the past maybe and feel like, I've applied, but no one's been, I've never gotten a response. What am I doing wrong? Maybe just giving them kind of some clarification about, here's our requirements and here's why. And if you're interested, here's a way to get your foot in the door.
Yeah. As we were, the past year or so, we've been really focusing on building our team. We had quite a bit of vacancies just due to, life events. We did not have the capacity really to take a lot of new grads with minimal inpatient exposure and experience, as we didn't have the bandwidth, we didn't have the staffing to really focus on training and mentoring. Things have really changed at this point in time. We have a team of very skilled, highly experienced SLPs, and we have space for dedicated time to mentor clinical fellows. So we do have one right now that will be transitioning to full-time and two that are coming on. And so while that may take a little bit of our resources in mentoring, I think that it is preferred for it to have some inpatient experience and exposure, but it is not a hard stop. And I think it just kind of depends on our staffing, our bandwidth, and what the need is at the time that we're looking to hire.
And I would just add, to follow up to your question about like how to get your foot in the door, if you are someone who maybe has experience in medical settings that aren't inpatient or mostly in a different setting, and you're starting the process of transitioning to medical speech pathology, sometimes people have to take a little bit of like a detour before they can get to inpatient care. So they might start off with like picking up a job in a skilled nursing facility or in a long-term intensive care type of setting, and then from there apply those skills in their application to a setting like this. And we've actually even had some applicants who have taken that advice, gone and said, okay, let me get a per diem job at this hospital because I'm mostly doing outpatient, but I want to get my foot in the door with inpatient. And then so they go to like a smaller hospital that doesn't have the same acuity and demands that Stanford does. And then they take that advice, they go and do it, and then they reapply, and they actually are successful with getting in for the interview or onto the team. And so I think there are ways to get your foot in the door, but it just might not be a foot in the door directly to Stanford if you don't have some of those foundational skills that we need for people ramping up, since our patient population is just so acute.
Thank you for that clarification. Well, I want to give you ladies a chance to have a breather. So I'm going to be passing it over to Jennifer Delgadillo, who is our Senior Talent Acquisition Specialist that oversees all of our rehab departments. Jennifer, so for someone that has the experience that Eileen's looking for, kind of can you walk them through the application process? What's the application cycle look like? How quickly can they get an interview? How quickly is onboarding? What are kind of those basic requirements that you're looking for on that application in order to be passing them over? And what's kind of a selling point with our benefits, or do we offer relocation? What makes us stand out versus some of our competitors?
Yeah, hi Carly, thank you. Hello everyone, thank you for joining us today. So I'm Jennifer Delgadillo. I have the pleasure of partnering with our inpatient acute hiring leaders for all of their therapy staffing needs, including SLP, PT, and OT. So a little bit about the interview process. Our positions are posted at our career site. You guys can go to careers.stanfordhealthcare.org. And once an individual applies, I review their application to confirm experience, license, certifications. Everything is met based on the position needs. The application is then forwarded to the department for further consideration. If an applicant is moved forward in the process, there will be a phone screen followed by an interview, which can be about an hour, and it will include a few individuals from the department. If an individual is selected to the final step of an offer, I will reach out to the individual to review the offer terms and next steps, such as determining a target start date, which is usually about a month out from the day of the offer. that was accepted. However, for SLPs, we are right now pushing out to January and February. At that point, we will also book a physical, begin the pre-boarding process. The first day consists of what we call new employee orientation, virtually usually, which is basically a great way to kickstart employment here at Stanford. For compensation, we all have a pretty competitive compensation package. And if you are relocating, we offer relocation incentive as well. And as the team was saying, we offer a clinical ladder to SLP 3 and 4, which does require some criteria, but that's also opportunity for advancement. As far as benefits, we have medical, dental, vision, which is active on the first of the month following the start date given. Enrollment forms and supporting documents are submitted within 31 days of hire. We have 3 options for medical. We have the Stanford Healthcare Alliance that's built around the Stanford Healthcare and Stanford Children's Network of providers. We have Aetna POS2 plan, which with HSA, and we also have a Kaiser HMO. And depending on the plan, there is access to teledoc and telehealth programs. We offer retirement as a nonprofit. We have a 403B. After 12 months of service and 1,000 hours of service, there is a basic employer contribution of 5% of the employer's eligible or the employee's eligible pay. And Stanford will match your own contribution up to 5%. So there is a potential of 10% additional money if you do not want to leave that on the table. So it's a great incentive. Tuition reimbursement, $2,000 or $1,800 per fiscal year. We do offer student loan repayments. This is an opportunity to allocate funds towards eligible student loans. And we have on-site childhood education programs. Let's see, just some really, exciting things about Stanford. We're a level 1 trauma center. We've earned the Lantern Award. We're a Magnet designated hospital. This recognizes quality patient care, nursing excellence, and innovations in nursing practice. You guys can reach me on LinkedIn and email if you guys have any questions regarding the SLP positions. Just feel free to reach out. We also, like I said, have OT and PT positions available. And anything else, Carly, that you'd like me to cover?
No, I think you did a great job. But when you kind of talked about the onboarding and NEO, I wanted to segue that back to Aileen and Madison. So once someone's hired as a speech pathologist, whether it's an SLP 1, 2, 3 here at Stanford, how do you typically onboard and train those employees to set them up for success in their new role?
That's a good question. Onboarding is a really important process in developing a cohesive team. And the stronger we are as a team, I think the better patient care we deliver. And so we take onboarding really seriously. We want to invest in our new hires. We want them to feel acclimated to the team and to the expectations of how to feel successful every day, but also to feel like as a team, we are practicing cohesively with shared application of, how we approach patient care so that every patient who comes to Stanford is getting high quality care from every speech pathologist on the team. So in terms of what that might look like, depending on the person, what they're coming in with in terms of their experience, where they've worked before, the patient populations they've been exposed to, and then with Aileen as the supervisor, sort of keeping in mind what our departmental needs are, we come up with somewhat of a starting plan of, okay, this is where this person's going to land first. They're going to be precepted by these speech therapists who've been working here. And maybe they kick off on the neurology floor units and get mentored by some of our speech therapists that have a lot of experience in neuro before then moving them to a different area of the hospital and kind of gradually exposing them to different populations with the goal of getting them vetted and signed off to be able to care for large portions of the hospital, especially if they will be picking up weekends. And then with that, there's specific criteria for not just familiarity and onboarding to areas of the hospital, but there's also specific clinical skills that we want to look at and make sure that someone coming on has those skills. And if they don't, if we see there's a knowledge gap, then we want to come up with a plan to be able to give them support in that area. So if it's someone who needs a little bit more training in managing dysphagia in an ICU setting, or doing their modified barium swallows, their fees, working with speaking valves, different competencies that a speech pathologist needs to be able to demonstrate, we go through a pretty systematic way of verifying those skills or identifying a knowledge gap and then figuring out a way to support the person so that they can meet that competency. And I think the process, I mean, the speed of the process really depends on the person, but we would rather not rush the process in order to have a high-performing, cohesive team. And we always look for people who come to the team really engaged in that type of process, who are eager to ask questions, not afraid to make mistakes early on so that they can have opportunities to learn, and who are receptive to feedback and input from our team so that we can work towards just getting everyone practicing and functioning like a well-oiled machine, which is what we are.
Thank you so much for that, Madison. That was so thorough. So in this role, what would you say are some of the bigger challenges that someone can expect to face when they're in this role?
I think that it can be a little bit intimidating. It's very high acuity, very fast paced. Our patients can be very, very sick, very complicated, with multiple medical teams involved. And so I think, for me, when I first started out, I had done my clinical fellowship at a community hospital. And so when I came to Stanford, I just wasn't expecting such a steep learning curve. And so I think we do a pretty good job of, letting prospective candidates know, I see you have some inpatient experience. Have you ever worked at a level 1? This is, kind of the nature of our day to day. It is very fast. It is very complicated. Don't be afraid to ask questions. So I think that is one of the challenges maybe a new hire might encounter, just kind of ramping up and not feeling too overwhelmed. Challenges otherwise.
I think one of the challenges, like thinking about the fact that the patient care here can be kind of complicated. As speech pathologists, we all know that there really isn't a set instruction manual on how to, do clinical decision making. We have instructions on how to do the diagnostic tests that we perform and treatment guidelines and things, but deciding what patient needs what, when, how much, and how quickly to advance a patient or progress a patient through a treatment plan. All of those things can be kind of tricky and nuanced when you're working with people who don't just have one thing going on. They have multiple things going on. And so I think that can be a tricky thing for clinicians to initially face. And that's why, really being able to lean into your team and ask questions and collaborate on care and not feel like you have to have the right answer, because sometimes the right answer is there's not just one right answer. There might be a couple different answers, and a good conversation can help sort that out. When we're working with teammates where that's the nature of how they work, it tends to be really successful, and the patient receives a really well thought out plan. So I think that can be challenging at first, especially if you're used to working kind of alone or on a really small team, or working in a setting where your patients come in with kind of one complaint or one medical condition. But I think we do a pretty good job as a team trying to keep the environment one where people feel comfortable working together and collaborating like that.
Yeah, and I think that also, I'll just add, I think that also extends to disciplines outside of the SLP department. We have we're so lucky to work in such a collaborative environment. Sometimes there's more than one option for the patient. And you can bring those options to the team and to the patient and say, let's talk about what's best for you. And so I just wanted to tack that on because that can also be a change for someone coming into this environment.
Mm-hmm. Yeah, and that goes even to our PT and OT colleagues. You know, we might be able to solve a situation like getting a patient down for an MBS who's a critically ill patient through really close collaboration with our respiratory therapist and the PT and transport and all these things. We can kind of think outside the box.
We can stuff a lot of people in that tiny little room.
Yeah. So if there's a will, there's a way.
So kind of staying within that, so what does a typical patient caseload look like per day? You know, how many patients can a speech pathologist expect to see each day? Does it vary? And does it vary based on they have lower numbers if it's more high acuity patients, or does it just, again, just kind of varies because you just never know who's going to be inpatient at the hospital on any given day?
Definitely varies. Our census fluctuates. Right now it's very high. So I think it kind of depends on the stability of your patient. So if you're working in the ICU, you may have a lot of sick patients that are just not appropriate for your intervention, and you'll have to be flexible and kind of triage them off and pick new consults up or new treatments up. You can expect to see, so for an 8-hour day, we assign about 6 to 7 patients per SLP. And for a 10-hour day, about 7 to 9. Now, instrumental swallow studies take up, a large portion of time. So technically, if you see a FEES, you are likely doing a swallow therapy as well. So those are 2 separate kind of appointments, if you will. So those, like that one patient may count as 2. And so we kind of weigh it that way. But yes, it really does depend on just the acuity of your patient, what's going on your unit that day, the hospital census, how many providers are paging out, and you're having to kind of restructure to accommodate requests.
Yeah, you have to definitely be flexible because things change every day, and what you start off with on your list might not be what actually ends up happening just because of a million different circumstances. But there are so many people who need our services and so many people who need to be seen that if things are falling through, there's always someone who would benefit from you picking them up. So I don't think it's challenging in that regard to meet your productivity requirements, because if you are attentive and picking up patients, there's always something to do.
How flexible is scheduling? When you get hired as a SLP, do you get the option to pick 10-day or 10-hour days or 8-hour days? If someone wants to move down to relief or per diem for 6 months, then move back up, is there any type of flexibility in scheduling? Kind of, can you walk us through how that works kind of when getting hired for these roles? Because I know you offer the various shifts.
Yeah. So when someone first onboards, we do like to have them here 5 days a week for 8-hour shifts. We keep them out of the weekend rotation initially and kind of introduce them depending on how the onboarding process is going for that individual. At the 6-month mark, we kind of check in and evaluate how they're doing, and if they, if that person would like to move to a 4-10 schedule. That is an option. We really believe in work-life balance, and sometimes the day can be so demanding that you're staying 10 hours on an 8-hour day anyway, and so it can get really tiring. So we totally understand that. But in the very beginning, while we're onboarding and just wanting to provide support, having you here 5 days is really helpful for that process. With regards to moving between positions, that has never come up before. I think it would just depend on the circumstance and the needs of the team at the time, but it's not like a hard no or it's never been a yes. So I'm not really sure how that works, but we've definitely had people move from, a full-time to part-time. And then if there's a position available, and then they, at the time we actually needed more help. So they were able to flex up back to full-time on a 0.6 schedule. So they would just like add another day and, intermittently be full-time, but hold a part-time position. So that's definitely something we do regularly if there's the need for that coverage, which there is. Was that it, Carly? Did I answer all your questions?
Yeah, that was perfect. So another question I had thinking about it. So Madison and you both have been here for over 5 years. What is your favorite part about working at Stanford on this department, and what made you make the jump from your previous employer to Stanford?
My favorite thing about this working at Stanford, hands down, is the SLP team.
Me too.
It's the team in general, like just the environment here. The culture is so collaborative and supportive, and there's something new to learn every day, and questions are welcomed, and it's just an environment where you can really thrive and feel so much job satisfaction. We actually were both students at Stanford. We were lucky enough to have the opportunity to experience this as grad students. And I think I'm speaking for myself, but I just fell in love with it. And I knew that was going to be my end goal. So kind of like Madison was describing earlier about getting your foot in the door, I had been at an outpatient clinic where I was trying to see as many adults as I could, and then got my foot in the door as a per diem at a community hospital and was able to work my way to Stanford's door. So I just kind of, I experienced the culture and the environment and the patient population early on, and I knew that that's where I wanted to end up.
I feel similarly. One of the things that makes this job feel so great is that I just love the team that I work on. I feel so supported by my colleagues. I feel like I can come to work authentically and just work on a team where I'm embraced for my contributions. And it's a really supportive, wonderful team to work on. And on top of that, the environment of just working at Stanford in general is really inspiring to me. I love to learn, and I love working around people who are passionate about their work and passionate about doing better and improving what they do and improving patient care. There's just always someone with a good idea and a room full of people who want to make things better. The doctors and the residents that we work with respect what we do. And so it feels really great to come to work and have a cardiothoracic resident want to sit down and review a fees with you because they're interested in seeing what it is that you do and what you found about the patient and how to collaborate in decision making. It's just a very cool thing. And I guess I'm kind of like, I feel like I'm a little bit of a unicorn because I didn't come from a different work environment. I mean, I came from a different career before I became a speech pathologist, so that's neither here nor there. But I was fortunate enough to get a student internship here, and then that turned into my clinical fellowship, and then that turned into a full-time position, and then over time that turned into the clinical specialist position. So I guess I'm an example of someone who was able to embody that sense of career growth and change over time on this team. And I feel like I've walked in a lot of different shoes on this team, and I understand what it's like to have a lot of questions at first. And I also feel like I understand what it's like to have a lot of ideas and want to contribute. So I think it's a really wonderful place to work. And I feel like I somewhat shot myself in the foot because I don't know if I would want to work anywhere else. So I might be stuck.
Well, I feel like that was the perfect way to end today's live, is just on that high note of just showing the joy that you have for working here and working in your department, and that you truly love coming to work every day. I think that's huge, especially in today's culture. So many people really just want to be able to walk into work every day, feel like they're working with a great group of people that are super supportive. And obviously you guys have shown that you guys are just a really collaborative team. But I wanted to say thank you to everyone that was watching today, as well as to Aileen and Madison for joining us, answering questions, and letting us learn a little bit more about our speech pathology team. On whichever platform you're viewing us on, we will be updating to include information on how to find out more about our speech pathology openings, how to contact Jennifer if you're interested in applying for a position, if you have additional questions about the position, if you want to learn more about our benefits. All of that fun stuff will be included in all of our updated captions for today's event. But again, thank you so much to Aileen, Madison, and Jennifer for joining us, and we hope that everyone has a great rest of their Tuesday, and we will see you next time.